Okay, now we want to look at the vertebral column. Some people say vertebral. Either one is correct. But we have 33 bones here that are called vertebrae. And they're classified by their structure and where they're found. And so each one of them is going to have a letter and a number to indicate the region where it is. The spaces between the movable vertebra you've got an intervertebral foramen. And if you look from the side laterally, you can see this, and we'll look at it in a minute, and you know that the spinal roots, nerve roots that go to all the parts of your body are going to pass through these foramina. And foramina just means a little foramen or a little hole. Now, we have 7 cervical vertebrae, and this is C1, starting at the very first one that articulates with the skull, and it goes down to C7. And they're the neck vertebra. And so it would be C1, C2, all the way to C7. You have 12 thoracic, and these articulate with the ribs and help form the vertebral column. So that's thoracic is T, and you've got T1, T2, all the way down to T12. You have 5 lumbar vertebrae in your lower back, L1 all the way to L5. And then you've got 5 that are fused. They're sacral vertebra, and collectively we call them the sacrum. And this is what articulates with your pelvic bone. As I said, it's part of your pelvis. And then you've got these fused coccygeal bones that we call the coccyx, and they can be anywhere from 3 to 5, and that is the your tailbone that we're talking about. Now, our spine has curvatures to help support the weight of our body. It should be shaped like an S, and when the baby is born, the infant's going to have a C-shaped spine, and as they develop these secondary curvatures that give it an S shape. The primary curvatures, this is at the thoracic area and the sacral area of the vertebra. And as I said, this is present at birth and during the development of the fetus. And then the secondary curvatures are cervical and lumbar. And these develop after the baby is born, before it starts to walk and crawl. It'll develop these secondary curvatures. This is critical for the ability of the infant to stand upright and walk upright. The cervical curvature helps you hold your head up, and the lumbar curvature supports the weight of your body. And that's what helps us to balance on our 2 legs. So if we look at the vertebra, you can see the S shape here that you're going to have. And you can see the cervical, that's a secondary curvature up here, and then the lumbar is also a secondary curvature that you develop. Now, there's some abnormal curvatures. You were all checked for scoliosis in school during PE. I know they do it in the 9th grade. I think they do it in the 6th grade. It's where it curves abnormally, and it's lateral. And that's scoliosis. There's lordosis, where you can have a sway back. And we notice it most often in the lumbar curvature, but can also be in the cervical. Kyphosis is when you have that hunchback look, because the thoracic curvature is too pronounced. And you can see here the difference. This is scoliosis. You see it's a lateral curvature of your vertebra. And then lordosis, you see how exaggerated the cervical is, and then again the lumbar is very exaggerated. And then of course the kyphosis, that's where the thoracic really is exaggerated, and you have the humpback appearance. Now if we look at the structure of the vertebra, they're all there to protect our spinal cord, and of course to support our head and our neck and our body. Now the body of it is the weight-bearing part, and there are intervertebral discs found between the different bodies of the different vertebra, they are for absorbing shock, and they are cartilage. The vertebral foramen, this is where all of the vertebra line up, and it creates a hole down the center where the spinal cord travels. Sometimes people call it the vertebral canal or vertebral canal. The pedicles are found on the sides of the vertebral foramen, and they merge into two laminae, and that's what borders the foramen posteriorly in the back. And the laminae and the pedicles together make this vertebral arch or vertebral arch. You have a superior articular process where it articulates above with the vertebra above it, and an inferior articular process on this vertebral arch that articulates with the vertebra up under. The transverse processes, they stick out on the lateral sides, and that's for attachment of muscles. And then the spinous process, that projects posteriorly. So it's also an attachment site for muscles. So if we look at them, you can see here's your body, this big area here, and then you've got the lamina here, and the transverse process sticks out from the lamina, and then the pedicle is here, and then this is the spinous process that sticks out in the back. So the spinal cord itself is going to go through this vertebral foramen or vertebral canal, the way they line up. And if we look at the side over here in the other picture, you can see the spinous process is sticking out here. You can see the intervertebral disc of fibrocartilage between the bodies. And you also can see right here, there is the intervertebral foramen where they line up, and that's where the spinal nerves enter and exit the spinal cord. Looking at the different vertebra, you're looking here at a cervical vertebra. This is a thoracic, and this is a lumbar. Let me go ahead and make sure this is okay. All right, the cervical vertebra, you see something in them that you don't see any other vertebra having, and that are these vertebral foramen, these holes right here. Those are in the 7 cervical vertebra, and that's for the blood vessels that go to the brain. And you can also see how the body is very small here, and the transverse processes don't stick out a lot, and the spinous process sometimes is actually bifid or branched in some of them. The thoracic, you see the body is a little bigger here, and then the transverse processes stick out further, and you don't have those foramina, those transverse foramina. The lumbar, the body is a lot bigger, and you can see the transverse processes stick out, but the spinous processes stick way out. And this is bigger, the lumbar, to support the weight of the body. Now, this is a picture of the sacrum and the coccyx, which is the bottom of the vertebral column. The sacrum is this big triangular structure, and it's 5 fused vertebrae. And you've got a sacral canal here, if you look at it posteriorly. Then up under that, it is fused with the coccyx, and there's 3 to 5 coccygeal bones that form the tailbone. And you can see how this curvature is right here as well. Now, just a study boost for the cranial bones, pest of 6. Parietal, ethmoid, sphenoid, temporal, occipital, frontal. And there's 6 of them. Virgil is now making my pet zebra laugh. These are your facial bones. Vomer, inferior nasal concha, nasal, maxilla, or mandible, and then maxilla, palatine, zygomatic, and lacrimal. Those are your facial bones. Virgil is now making my pet zebra laugh. Every student fancies learning zillions more parts, and this is what you find in the orbit of the eye. Ethmoid, sphenoid, frontal, lacrimal, zygomatic, maxilla, palatine. All of those can be found in your eye socket or your orbit of your eye. Now for the vertebra, there's some tricks. You have breakfast at 7, and that's at the first part of the day or the first part of the vertebra. You have 7 cervical. You have lunch at 12. You have 12 thoracic, and lunch comes after breakfast. And for dinner, you have 5 lumbar. And dinner is the last meal of the day. So at the top of the vertebral column, you've got cervical, then in the middle of the day, thoracic, and then lumbar is at the end of the day. Excuse me. These are some others. The sphenoid bone looks like a bat. The ethmoid bone looks like an iceberg, and only the tip of it, the crista galli, is actually something you see. The thoracic looks like a giraffe, and the lumbar looks like a moose. See, the thoracic looks like a giraffe, and the lumbar looks like the moose. So that should help with those. Now, one other thing we want to mention is the intervertebral disc. There are 23 discs of fibrocartilage found between the vertebrae, and this is for absorbing shock and helps to bind it together. The disc, you've heard of people having a herniated disc or a ruptured disc or a slip disc. That's what we're talking about. And the reason is because it's got 2 parts. Outside the, on this outside part, that's annulus fibrosus. That is the fibrocartilage. Inside, right in here, is a jelly-like nucleus pulposus. And that jelly can sometimes slip out, and it'll be on the side of the vertebra. Well, there's all sorts of spinal nerves coming out from above and below the vertebra in those intervertebral foramen, and they get pinched on by that nucleus pulposus.